Hello and welcome to On Second Street. We often hear about artificial intelligence every day. It's in the news. We're hearing about all kinds of different ways that it can be used throughout society. One thing that's important to think about is what is the potential in healthcare for artificial intelligence? Where is it being used right now? Today we're going to have a big discussion about the potential of healthcare in artificial intelligence in Canada. We've got two excellent guests lined up. We've got Zayna Khayat. She is a health futurist with the Rotman School of Business. And we've got Walter Robinson, who's the founder of Getting Strategy Done. Walter, you've been on our board for a number of years now. I should have tapped into your expertise in this subject a long time ago because it's such an important thing. I wonder maybe if you could start the conversation by just telling us a little bit about artificial intelligence in healthcare. Maybe start with the definition and some examples of how AI is used in healthcare right now that we might not even know about.
Well, thanks for having me on, Colin, and it's great to be with Zayna. I hope she carries the bulk of this conversation. Uh, Artificial intelligence, and I don't want to be a computer scientist, but it's basically the use of artificial intelligence needs two things. It needs a lot of data and it needs computing power, and it can automate tasks. It can give us decision support. It's algorithmic, and we've been using it now for 10 or 15 years on our phones. Everything you do on your phone, every swipe has some sort of AI component to it or chatbot. And what is different now in 2025 is that we are now not only figuring out what is happening, but why, how, where, and when. A couple of places where artificial intelligence has been used in healthcare now for over a decade: radiology, imaging, x-rays. Computers can scan millions of images. AI can scan millions of images to see different lesions or different tumor types, those sorts of areas. Lots of the imaging specialties. Let's think about dermatology. We can look at millions of images and determine types of tumors. And we saw some of this during the pandemic in terms of telehealth. And we're also seeing it in primary care with generative AI, chat GPT and the like, helping healthcare professionals transcribe their notes or making sense of doctor scratch and get into structured and unstructured data. A lot of it is now being used in the back end in billing and receivables and insurance claims. So it's been used for quite a long time. And every time we've done Netflix or an airline reservation, we've been training and improving artificial intelligence, or it's been training us.
Zayna, what about from your perspective? You've been working on this for a number of years now, taking a close look at AI and healthcare, the potential and so forth. Are there any areas in that it's used, maybe that Walter didn't mention, that people should be aware of and how it's helping right now?
I think Walter covered it, and maybe we'll get into a few more specific examples of like what's really happening in Canada versus the rest of the world. But I think maybe just other language people might have heard: machine learning, natural language processing, Gen AI. So let me just break those down a little bit more because there's really nice mapping to healthcare. So in machine learning is using those advanced computational techniques that Walter said. Processing speed of computers plus data is like a perfect marriage. So now we can do things and predict information from patterns, from rules that we want to feed it. Well, that's a big part of medicine. Medicine, at the end of the day, is judgment based on taking in information and then predicting, which is judging what's the next best action. A clinician is doing that instantly like a human brain. So that's machine learning. So that's the predictive side. Natural language processing then takes that machine learning plus advanced statistics, ingesting the images that Walter said and other information, and spitting out either documentation or recommendations. And then generative AI is a new baby on the scene, but this is going to be huge in healthcare because those first two to me are the back of the house. Behind the scenes of what a patient experiences, decisions have to be made, and we train clinicians for many years. Front of the house is how we communicate with patients. Gen AI is now allowing some very magical things there. So we've got 3 points of 3 types of AI that are the entire value chain of medicine, from operations to patient experience.
Okay. Very quickly, Zayna, in your view, is this something that's necessary? We've got an aging population, great demand for healthcare workers. It seems like we're not going to have enough healthcare workers. Is automation part of the solution?
Yeah, so I would, the automation aspect of AI, which, in plain terms, we would think is, machines can do what humans already do, but basically, let's say for free or way, way
Mm.
faster.